My discussion was surrounding the use of the serum lactate testing with sepsis and septic shock. Now, some statistics indicate that septic shock is a leading cause of acute hospital mortality, which is as high as 45%, and additionally, septic shock can be recorded as the costliest in-hospital condition internationally. Now, despite these statistics being in hospital, it is appropriate for pre-hospital research to be conducted as not all septic patients present themselves to ED. Now, the definition of the infection process is the infection beginning with the invasions of microorganisms that are not normally present in the body. Now, these organisms can cause damage and potentially death to the host with the infection process. And these infections do not always become systemic, and they can remain localized. However, when they become systemic, that's when they invade the bloodstream or lymphatic vessels. This becomes sepsis, and this can result in an uncontrolled inflammatory response, producing and releasing large quantities of inflammatory cytokines. Now, this systemic response syndrome causes generalized vasodilation, vascular fluid loss, myocardial depression, increased vascular permeability, and circulatory shock. Now, severe sepsis is defined as that sepsis with organ dysfunction. Now, septic shock is the presence of severe sepsis with hypotension that is unresponsive to fluid resuscitation. Now, other associated signs and symptoms with septic shock includes a flushed, warm skin, a decreased in systemic vascular resistance. Additionally, there's also changes to cognition and behaviour due to the decreased cerebral blood flow, as there is a widespread hypovolemia present. Also, an increase in serum lactate and metabolic acidosis indicates that anaerobic metabolism. Now, serum lactate testing is the test of lactic acid levels within the blood. This is taken the exact same way as a blood glucose test, as the test just requires a sample of blood. It is then used to analyse the levels of serum lactate within the blood. Now, normal serum lactate levels are below 2 millimole. A test result showing between 2 and 4 millimole indicates sepsis or severe sepsis with organ dysfunction, and a result above 4 millimole indicates septic shock. Now, the algorithm is applicable to those septic shock patients, as the use of serum lactate is vital for the diagnosis of sepsis and septic shock, especially in the patients that do not have an obvious source of infection. Now, this allows for the treatment of septic shock to commence, as it provides a diagnostic tool to ambulance and community remote personnel. The serum lactate testing is best placed with the identification of the infection site, as it is not always clear where the infection has started. You would then continue to use an unknown treatment plan, as serum lactate only indicates an infection is present, not where the source of infection is. Now, this treatment plan includes 1 to 2 litres of sodium chloride IV. Then you've also got 1.2 grams of amoxicillin and clavulanic acid, as well as the treatment of gentamicin IV. Now, if the patient is not improving, even with 2 litres of sodium chloride administered, you then move on to an adrenaline IV infusion. Now, with the community and remote setting, it is vital, as the patient is always outside that 30 minutes of transport, and it determines that the patient needs urgent IV antibiotics and the need for fluids as well. Now, multiple articles recommend further research into testing of serum lactate, especially in the community and remote setting, with further research can influence what treatments can be provided in the community setting and what needs urgent hospital care. Now, for the community and remote setting as well, it is appropriate, as it could indicate if we go broader with our IV antibiotics and start providing more specific treatments for the soft tissue or joint or chest, if it's more appropriate to have a more specific IV antibiotics for meningococcal septicemia, or if the best treatment plan for unknown is that amoxicillin, clavulanic acid and gentamicin, since it is broad spectrum antibiotics.